Hello, everyone. Today, we will discuss health promotion and disease prevention. I am Isawan Pechlorlian from the Division of Geriatric Medicine at Chulalongkorn University. Declare, I use Google Vid's AI voiceover to narrate this slide and Gemini to improve grammar and clarity, but the outline and all content are my own design to help you with the learning. In this video, we will explore the core principles of prevention and screening. We will also cover how these practices are applied to common conditions affecting the elderly. Our outline includes the principles of prevention and screening, cancer screening, and immunization. Please note, this content serves as an introduction and is not a comprehensive guide. To take care of a real patient, you will have to learn more screening recommendations, including cardiovascular risk factors, osteoporosis, and geriatric syndromes. Let's begin by examining the fundamental principles of prevention and screening. This diagram illustrates the spectrum of prevention, ranging from general health promotion to specialized care for complications and rehabilitation, depending on the stage of the individual's health. If a patient is healthy and we want to make them become healthier, that is health promotion. Primary prevention is when a person has only risk factor and we want to prevent disease to occur. Secondary prevention is when a person starts having preclinical disease or mild disease and we prevent it from progress to significant or symptomatic conditions. If a patient already has clinical symptom, tertiary prevention helps stop progression to more severe complication. Finally, rehabilitation helps restore patients back to their normal or healthier state. Let's take a look at some examples. Here, we see examples of primary and secondary prevention using diabetes mellitus and coronary artery disease as models. Surely, anyone would say that healthy lifestyle is primary prevention for both conditions. But taking medication for diabetes would be considered secondary prevention for DM, but a primary prevention of coronary disease. So, one measure can be primary, secondary, and tertiary kind of prevention, depending on the disease we are looking at. Next, we will talk about screening. Screening is testing for an asymptomatic state of a disease or the risk factor. Screening usually consider primary or secondary prevention that apply to a large population. Thus, the cost and effectiveness of screening should be considered. Let's take some time to think if we should screen for common cold. This serves as a starting point to think critically about when screening is appropriate. If you need more time to think, please stop the video here. Personally, and I think most will agree with me, that we do not need to screen for common cold because the disease is so mild that almost everyone will cure by themselves. Some exception may arise in case we want to prevent spreading of the disease to a very susceptible person, like immunocompromised patient. For example, we may have to ask anyone having common cold to avoid visiting a patient who is taking immunosuppressant. Then what about brain tumor, which is important enough? Should we screen it? Again, take some time to think and craft your reason. My answer is no. Not because brain tumor is not serious, but because it is rare. Population screening of a rare disease would not be cost-effective. But if says you have a patient with strong risk factor, such as exposed to high radiation or has a family history of some rare disease, specific screening in the patient at elevated risk would be justified. I hope you can see that. Screening is not something you do out of good heart. Appropriate screening depends on 3 aspects. The condition you would like to screen should be common, serious, and have some window period to be screened. For example, we can screen for risk factors of MI, but we can't screen for MI itself because the disease develops suddenly. Next is the test. It should be somewhat accurate, not producing too much false positive and false negative. Also, the test should be accepted by the subjects, not cost too much and not too invasive. Finally, the treatment. If we detect a disease that have no cure, then the screening may not change anything. Also, whether the existing treatment is accepted by the person should also be considered. After you have learned the principle, let's think about screening for preclinical state of Alzheimer's disease with PET scan. Should we do that? Think carefully. Another question is, as I have said, screening should not be done out of good heart only. It should be evidence-based. I believe you have learned about various research design. Take some time to think. Which type of research in this image is the best kind of evidence to lead the decision to screen or not to screen? You can answer anything, but not systematic review. This concludes the first part of our video. Please complete the provided Google form and read my answer before we continue to the second part.